For those who have contracted COVID-19, you know it can be a debilitating virus that can ravage the body, manifesting itself as an upper respiratory illness to creating gastrointestinal complications. For some, once the virus has left the body, the fight has not ended. A rare complication can emerge, but MUSC has just become the first in the nation to unveil a new treatment for MISC. Here to tell us more is Dr. Andrew Atz, chair at MUSC's Department of Pediatrics, and Dr. Allison Eckard, associate professor at MUSC. Doctors, thank you for being with us. Dr. Atz, I'm going to ask this question to you first. What is MISC?
Yes, it's a fascinating thing that the entire world is really just starting to learn about over the last few months. It's called Multisystem Inflammatory Syndrome in children, and it is a post-infectious condition. After you're recovered from COVID, this is your body's hyperreaction to the healing process. And it turns out that there are multiple organs that are intensely inflamed, and it's not inflamed with the virus itself, it's inflamed with all sorts of cytokines and other inflammatory mediators that the body naturally produces in order to fight the virus.
Dr. Eckard, can you tell us, is this something that only happens in children, or can it happen to people of all ages?
So at this point, it's been only described in children, and the average age is about 8, but it's been described in infants all the way up to children and young adults around the age of 20.
And Dr. Atz, you had a patient come into MUSC's Children's Hospital with this condition. Can you tell us what the mother had experienced with her son and the journey of fighting COVID-19 and then having to fight a new complication?
Sure. This is it's a tale that is starts off being difficult to figure out what's going to happen. He really had a number of days of having very high fever, much higher than most parents are used to seeing, 103 to 105. And we found him to be really in what we call shock, high fever with low blood pressure and signs of organ damage to multiple organs.
And so what was your discovery? How did you find the cure, as it were?
Right. So we had the suspicion, the minute he came in. We've seen a number of these kids over the last couple months with similar symptoms. And so we start a number of treatments that we typically give in Kawasaki disease, immunoglobulin, high-dose aspirin, high-dose steroids, all in an attempt to turn down the immune response that is so out of control.
Oh, goodness gracious. And him being just a 4-year-old boy. So how long did it take for him to completely heal?
So he was already on the mend within a couple days with our very aggressive treatment. Dr. Atz and I were talking about this experimental treatment and whether he'd be a candidate, which is what we decided to proceed with. So shortly after that, he really was running around and doing great, and was soon discharged after that. This is just a really exciting study and opportunity for potentially better treatment for MISC. So we gave this particular product under an expanded access protocol, meaning that it's been approved in an emergency situation.
That's wonderful to hear. I want to thank you so much, doctors, Dr. Atz, Dr. Eckard, for joining us today and giving us that wonderful information. We will continue to look forward to seeing KJ grow after his recovery, and certainly hope that no more children are affected by this. Such a mystery illness, but you managed to figure it out. That's fantastic news. We're back after this.